It's estimated that 500,000 Americans suffer from Crohn's disease, which is a chronic inflammation of the gastrointestinal tract. And while there is no cure, newer medications and combination therapies are helping minimize the severity. Local 10's Christy Kruger has more.
When 18-year-old Emily Miller was diagnosed with Crohn's disease 4 years ago, her first reaction was denial.
It's scary to know that it's permanent. I think that's the hardest thing, is like you get colds, they come and go. You can have many different sicknesses, but usually they go away, and this I knew was permanent.
Gastroenterologist Dr. Charles Gluck says Crohn's, like all autoimmune disorders, is on the rise.
I think a lot of that has to do with the incidence of environmental toxins, free radical formation, pollutants, food preservatives. Our immune systems are really being affected globally.
Symptoms of Crohn's are varied, but include abdominal cramping, fever, fatigue, loss of appetite, and unintentional weight loss. The latest treatments for the disease involve the use of drugs known as biologics.
These drugs are designed to not only help your symptoms, but they actually can cause remission. So this is changing the whole natural history of this disease.
Dr. Gluck says biologics reduce the risk of complications from the disease and the need for surgery, both of which used to be a given for Crohn's patients.
Whereas these biologic drugs, like all new drugs, had originally been introduced as your last hope, with more experience, they've been moving earlier and earlier into first position.
Biologic medications don't work equally on everyone. While Emily's Crohn's has been managed, it's not in remission. Still, she's doing everything she can do to live as normal a life as possible.
For so long, I had been worried that I wasn't able to accept my disease without being defined by it. And now I'm learning to accept it and realizing that it doesn't define who I am. And I do forget sometimes that I have it.
Family history of Crohn's, Jewish ancestry, and smoking are all big risk factors for Crohn's disease. Of course, you can't choose your family, but you can choose not to smoke, and that would lessen your risk. With today's medical report, I'm Christy Kruger.